Today I will be reflecting on a case I've attended during my clinical placement. The incident involved a 52-year-old female who was feeling nauseous and when standing was extremely lightheaded and dizzy. As a result, she had 2 falls on her way to the bathroom the previous night. The patient had a history of epilepsy and was intellectually impaired. On arrival, the patient, who lived with her brother and nephew, was lying in bed, slightly pale in colour, and had been experiencing excessive vomiting. After acquiring relevant information through obtaining vital signs and questioning the patient, as well as her family, she was administered medication to relieve her nausea, then transported to hospital. Due to the patient's intellectual impairment, this incident involved the use of effective communication in order to gain relevant information and provide sufficient care. Prior to this case, I had not experienced treating an intellectually impaired patient. I therefore did not have any acquired skills, but through covering some communication topics in subjects at university, I had basic knowledge in terms of theory. When we were called to the incident, we were made aware of the patient's intellectual impairment. Therefore, I was able to mentally prepare myself. As every case is different, I did, however, find it difficult to put my basic theoretical knowledge into practice with a real-life situation. Some further skills I learnt during this case from my mentors was that when communicating, it is important to be aware of your choice of words, tone, and timing. Due to the patient's intellectual impairment, the best way to obtain relevant information was to continuously ask the same question to ensure she did not change her mind or add other facts she'd forgotten. However, in comparison, a mental health case attended after this incident involving a man who did not like being asked lots of questions. In this situation, my mentors took the approach of giving the patient some space and time to think before they continued to ask questions. For the incident, it was extremely effective, as when we returned, the patient was willing to cooperate and answer questions. This communication approach, however, would not have been effective for the original incident, as she did not require time or space, but instead responded better to being asked questions multiple times. This is proof that every situation is different and every patient will respond in a different way. The main issue revolving around this incident is the importance of communication between the paramedics and the patient. Contributing factors towards this incident include the patient being intellectually impaired and having slurred speech. According to the Intellectual Disability Rights Service, intellectually impaired is characterized by sub-average intellectual functioning, meaning that the patient will have trouble learning and functioning in everyday life. These factors are important in understanding the incident as they cause communication to be slightly difficult, requiring a different approach. The patient had the mental capacity to answer questions, however she tended to continuously repeat irrelevant information, whilst failing to recall prior incidents such as her 2 falls. Another example is that the patient had slightly slurred speech. We were then able to ask the patient's brother and nephew whether this was normal, in which they told us it was significantly more slurred. This was significant information to acquire, as according to the New England Journal of Medicine, slurred speech can be signs of stroke, brain injury, or brain tremors. From reflecting on this case, I now understand how important it is for a paramedic to be able to communicate effectively with not only the patient, but also their family or friends and bystanders. It is important for me to reflect on the cases of this nature in order to understand what different factors may arise in future cases. For this incident, it is important to consider what may have happened if the patient's family were not present. Firstly, she may not have even called the ambulance. Secondly, we would not have known the extent of her falls, being information such as if she hit her head. Thirdly, we would have been unaware of her increased slurred speech, therefore unable to reiterate it to the hospital, which could be a serious factor in contributing to diagnosis. For future cases where no family members are present for a patient of this condition, I will be more aware of the information that they may neglect to state. In terms of communicating with intellectually impaired patients, it may involve reconstructing future practices in order to take on extra or alternative methods. It could be beneficial to adopt some approaches outlined by the Journal of Psychiatry and Neurology. They state the importance of firstly building rapport, then allowing plenty of time to ask questions. It is then suggested that you deal with one piece of information or question at a time, letting them explain their story in their own words before clarifying and asking continuing questions. The journal also states the significance of using plain everyday language and relaxed body language, whilst continuously ensuring the patient understands what they are being asked. In terms of applying these forms of communication, some approaches will work for one situation, whilst not for another, as it is all relevant to the seeing patient situation and handling ability of the paramedic.